Welcome. This presentation deals with automated pre-visit workflow of patients. Before the patient visits a clinician, most, if not all, the patient's medical, demographic, insurance, and other information can be obtained virtually via a virtual medical assistant. Dr. Anthony Ingram is a family medicine physician with a solo medical practice in a large city in California. His peers affectionately call him Dr. AI. Dr. AI has been studying about automated pre-visit workflow of patients. He would like his new patients to expect a good healthcare experience. What can Dr. AI do as a family physician to automate the patient's pre-visit workflow and eliminate the hassle of information collection? Also, what can the patients do virtually at home, by phone, computer, or smartphone if they develop an illness? Dr. Ingram wanted to know what a virtual receptionist and a virtual medical assistant do to enhance the pre-visit workflow. His goal is to orchestrate an optimal patient experience and implement an efficient and automated pre-visit workflow. To that end, Dr. Ingram had a meeting with an IT specialist and asked his prepared questions. Question: how do I streamline my clinic pre-registration process? Answer: you should design a pre-registration process that integrates seamlessly into the practice workflow. This process will save time for both patients and your clinic team workers. Question: what do you mean by integrate seamlessly? Answer: the concept of seamless integration for patient registration and pre-registration is to streamline the patient registration process by eliminating paper forms and ensuring direct entry into the registration software and electronic health record, EHR. Seamless integration is beneficial because all important information can be collected prior to the visit by the patient. It is more efficient to reduce manual data entry, minimize errors, and accelerate the registration process. Direct entry reduces transcription errors and ensures accurate patient information. And there is real-time access to patient data across the healthcare system. Question: what steps should be followed to implement seamless integration? Answer 1. Software integration. Ensure that the registration software and EHR are interoperable. Data entered during registration should seamlessly flow into the patient's electronic record. 2. User training. Train registration staff on using the integrated system effectively. 3. Workflow design. Design a streamlined workflow for patient registration, including data collection and entry. 4. Patient experience. Consider user-friendly interfaces for patients to provide necessary information. And 5. Security measures. Implement robust security protocols to protect patient data. Question: what does the pre-registration information include? Answer: please remember to collect essential patients' details before their actual visits. The pre-registration information includes demographic details: name, date of birth, address, phone number, emergency contact, payment information, insurance details, copayments, billing preferences, medical history, relevant medical conditions, allergies, medications, surgeries, collaboration with team. Work with nurses, administrative staff, and IT professionals to define the required data elements. And finally, customize pre-registration forms based on specialty, for example, pediatrics versus geriatrics. Keep in mind that successful integration requires collaboration, clear communication, and ongoing evaluation to optimize the process. Question: what do you mean by collecting necessary information? Answer: you should ensure compliance with the 21st Century Cures Act and the Office of National Coordinator Owen Cures Act Final Rule. You should collect United States core data for interoperability, or USCDI, demographics intake, and administrative and clinical PDF forms. Question: what do I need to know about the 21st Century Cures Act and the Office of National Coordinator Cures Act Final Rule? Answer: in 2016, the U.S. Congress passed the 21st Century Cures Act to improve access, exchange, and use of health information. The Office of the National Coordinator for Health Information Technology implemented the Cures Act Final Rule to promote patient control over their health information. The goal is to give patients access to their electronic medical records at no extra cost and allow providers to choose the best IT tools for patient care. Question: what exactly is the United States Core Data for Interoperability, or the USCDI? Answer: the US CDI is a standardized collection of health data classes and elements. It enables nationwide interoperable health information exchange. It includes clinical notes, test results, and medication information. Your healthcare team should use the US CDI standard as part of the new Application Programming Interface, or API certification. This ensures that the APIs follow modern computing standards and allow for interoperability. Question: what happened to the Common Clinical Dataset standard, which I have been using? Answer: well, the US Code Data for Interoperability has replaced the Common Clinical Dataset in various certification criteria. The new US CDI criteria cover areas like transitions of care, clinical information reconciliation, data transmission to third parties, and more. Complying with the 21st Century Cures Act and the Office of National Coordinator Cures Act. Final rule involves using the new US CDI standard for health data exchange and ensuring interoperability through application programming interfaces, or APIs. So the new US CDI replaces the older CCDS in certification criteria. Okay, please explain to me what new patient coordinators are. Answer: new patient coordinators, or NPCs, are healthcare team who are appointed to conduct new patient pre-registration virtually over the phone or in person before the initial visit. A virtual medical assistant, such as a robot, can handle pre-registration 24/7. The NPCs will capture demographic information, including essential personal information, as well as enter medical details directly into the EHRs, such as medication lists, allergies, and medical history. By doing this, NPCs reduce the data entry work required of clinicians during the patient's initial visit. NPCs can also answer, virtually or in person, any questions the patient may have about the upcoming visit. Question: what are my virtual pre-registration options for patients? Answer: you can offer virtual pre-registration options for patients, allowing them to complete necessary paperwork from the comfort of their homes. Patients can schedule appointments online, where patients can choose convenient time slots. Patients can submit digitally insurance and intake information, such as medical history and other relevant documents, through a secure portal. Patients can also check in virtually before arriving at the office, which reduces waiting time at the clinic. Okay, now please tell me, how can a virtual receptionist help at the clinic? Answer: you can employ a virtual receptionist that is an AI-driven chatbot or automated system, or a human virtual receptionist to enhance the pre-visit workflow. The virtual receptionist can send automated reminders via SMS or email, ensuring patients don't miss their appointments. Patients can ask the virtual receptionist basic questions, such as office hours, location, and parking. If a patient's condition requires specialized care, the virtual receptionist can guide them to the appropriate specialist. After the patient's visit, the virtual receptionist can gather feedback to improve the patient experience. Question: how about virtual medical assistants, VMAs? How do they differ from the virtual receptionist when gathering initial patient information? Answer: VMAs can play a crucial role in obtaining initial patient medical information during pre-registration or admission. VMAs can assist with collecting essential details such as patient demographics, medical history, allergies, and current medications. VMAs can also guide patients through the necessary paperwork and consent forms. By automating these tasks, VMAs free up nurses' time, allowing them to focus on more complex patient care. Question: do VMAs and nurses use large language models, or LLMs, for triage, and how accurate are they? Answer: large language models, such as ChatGPT-4, have shown promise in several healthcare applications, including triage of patients at clinics and hospitals. For triage purposes, nurses and VMAs can use large language models, or LLMs, to 1. Assess preliminarily the symptom severity, for example, mild, moderate, or severe. 2. Prioritize patients based on urgency, ensuring timely care for critical cases. 3. Provide initial guidance and offer general advice while waiting for a physician's evaluation. 4. Screen for red flags such as sudden chest pain that require immediate attention. LLMs can assist nurses in generating preliminary diagnoses based on patient-reported symptoms and vital signs. However, it's essential to recognize LLMs have limitations. LLMs rely on accurate input data. So if the data that is inputted is garbage, what comes out is also garbage. LLMs are not infallible. Nurses should use their clinical judgment and consult physicians for complex cases. Transparency about AI involvement and patient consent are crucial. And both liability and accountability need careful consideration. Here is another question. Can you tell me about integration with specialist referrals and the virtual receptionist's role in arranging visits with specialists? Sure. Here are 3 considerations regarding integration with specialist referrals. 1. When patients seek specialist consultations, the virtual receptionist evaluates their symptoms and urgency. If urgency is evident, such as severe pain or sudden vision loss, the receptionist prioritizes immediate consultation. Urgent cases bypass regular appointment slots and receive prompt attention. 2. The virtual receptionist provides essential details and information to the medical specialist. Then the virtual receptionist finds out the available time slots for consultations. And if referrals to specialists are necessary, the receptionist guides the patients through the process. 3. Finally, the receptionist assists the patients in scheduling appointments that are suitable to them, and it sends reminders, confirms appointments, and ensures a seamless handoff to the specialist's office. Another question. What can you tell me about continuous improvement in my office? Answer. Doctors should regularly gather feedback from patients and staff to fine-tune the pre-visit workflow. They should also monitor the effectiveness of the automated pre-registration processes and make adjustments as needed to optimize the patient experience. Doctors should actively ask patients about registration processes, wait times, clarity of instructions, and overall satisfaction. Doctors should engage with administrative staff, nurses, and receptionists who can provide valuable feedback. Staff insights help identify pain points and areas for improvement. Finally, doctors should fine-tune the pre-visit workflow based on feedback. Doctors should simplify paperwork, reduce redundant steps, and optimize data collection. They should ensure clear instructions for patients during pre-registration. Address bottlenecks that cause delays in the workflow. Equip staff with the necessary skills to handle patient interactions effectively. Assess the effectiveness of automated processes. Verify that patient information flows accurately into the HER. Keep in mind that smooth pre-visit experience sets a positive tone for the patient's journey. And the less paperwork means more time for patient care, happier patients, and happier doctors. Thank you very much for listening.